So if you are struggling with hip, knee, or lower back pain, this affects your mobility, right? So I see a lot of people that come in and they have trouble bending down to put on their shoes or socks. They have trouble going upstairs. They have trouble walking in an upright position. Different areas are affected by that. The mobility throughout the spine and really throughout the body are affected when you have that tightness in there. And today we're going to dive into why that is and some of the things that you can do to ultimately minimize some of that and help yourself gain back that mobility. Because when we look at mobility, it's one of the most important things, not only for brain function. I mean, the whole purpose of brain development, or the whole purpose of movement, is to develop the brain more. So when we lack movement, we lack stimulation to the brain. But it's also one of the most common reasons that people end up in nursing home, right? If we start to lose strength, we're more prone to falls. We're more prone to not being able to do the things that we need to do to get through our daily life. So having this mobility, having this strength, having this ability to move through a range of motion is actually a very, very important part of life. I'm Dr. Jeff Cumro, and over the past 15 years, I've had the pleasure of working with thousands of people. And ultimately, what we do in our clinic is we work to get the hardware, the brain and the body, optimized, functioning as well as they can. But we also work to get the software. We have to get that energetic system to supply the brain and the body, because if we have one and we don't have the other, it really doesn't do you any good. So we've got to have the brain and body functional, and we have to have the energies to supply that. So let's go ahead and dive into our topic today. And I'm going to do some pretty terrible drawing here, and I will apologize here before we even start, but it's going to be enough to get the point across. So what we're going to draw here is just the hips. And you guys can get an idea that that's the hips. That's not something that is a perfect drawing by any means, but it's enough to get the message across here. So that would be your pelvis in general from the front angle. And what we're going to do is also look at it from the side. So when we look at it from the side, we said a little bit more like this. And this is more of a neutral. This is ultimately what the spine should look like. This is more of a balanced rotation on this, and your tailbone to be back down here. So we want all of this to be balanced. We want to be balanced front to back, left to right, top to bottom. And when we have that, we have the function that we need. Unfortunately, most of us are a little bit more prone. We have a little bit of dominancy in one side of our brain or the other. That leads to certain areas that are a little bit more tight than others. And this provides our personality. It provides, the strengths and weaknesses that we have. It provides a lot of different things throughout our day. But muscle tone is one of those things that's affected by this. And that part of that is balance. Part of it is, the mobility centers, the way that we stand, the things like that. So I hear a lot of people say, I have one leg that's longer than the other, one leg that's shorter than the other. And in most cases, this is not actually like the leg is actually challenged. It's not really like changed in length. If you take a tape measure and you measure from point to point, the legs are the same length. In most cases, it is a functional change. So the hips have rotated a little bit. So if we look at this, one side is higher or one side is lower, and that has altered that, right? So this leg over here would appear to be longer, this leg over here would appear to be shorter. It's just the rotation of that, the functionality. They're functioning in a different way, and that ultimately changes how we go about things. Now, this is all important to know, because when we have that, we're going to be prone to certain things. I don't know if you are like this, but a lot of people that I see have all of their issues on one side or the other. Every issue that they have a bad knee on the right, they have a bad hip on the right, their shoulder is bad on the right, whatever it may be, it's all on one side or the other. And this is a common problem. And it's something that comes from this, right? If we have certain muscle tightness in certain areas, it leads us down that path. When we have that dominancy in certain areas, we tend to move in certain ways that is going to increase that. So back to the topic at hand here. When we see a lot of people, they have the difficulty in mobility, and all of this is ultimately what dictates this. And it's not the only thing. I mean, you can have a knee injury or different things like that lead to some of this, but when we have challenges in the pelvis area, it has a big impact on the rest of the body, right? We're going to dive into that. So since I don't have a ton of room here to kind of demonstrate physically, and some of this can be, I don't know, it can be a little awkward to demonstrate physically. So we're just going to look at it visually through the drawings here. Hopefully I can do a good enough job, and we can go through from there. So, you know, speaking in general terms, this is what we're supposed to look like. So this would be pelvis here. This would be your feet down here. Arms are up here. What we want to see is, it's facing this way, so there's your nose. So what we want to see here is we want to have the ear be kind of in line with the shoulders, be in line with the pelvis, be in line with the heels. What we commonly see on this is we see somebody who is in a position more like this. So they have an anterior bend in their pelvis. So instead of having the pelvis flat across the top, we see that anterior tilt of the pelvis. This makes it very, very difficult. So basically everything is tilted this way, it's tilted forward. And what that does to the leg is it brings it backward. So when you have that leg backward, it's very, very hard to raise your leg in this position, right? And I'll stand up and give you a little bit of demonstration here on this. It's kind of difficult with the amount of space that we have here. I dropped something, not sure what I dropped there. But when we have this and we tilt into this forward position, it's hard to raise your leg very high. Like right there is about as high as I can raise that leg. When we stand up straight, you can raise that leg significantly higher, right? It's just that physiological block of the bones that are in there. So that anterior tilt of that pelvis is putting us into a weak position where we can't raise that leg as well. These are part of the problem that you see in people that are having trouble putting on their socks, taking off their socks, putting on their shoes, taking off their shoes, bending forward to do anything. It's just a difficult position to actually get the muscles to function in the way that we want them to function, right? So it greatly limits your mobility through that lower back and through the pelvis in general, this whole area right through here. It also changes the way that your knee is affected here, right? Because as soon as you start leaning forward, you start extending your legs. So you lock your knee, so you end up getting a lot more stress in the muscles back here. That drops that kneecap into the knee joint, and they start to rub. So you get degeneration of the knee, you start getting degeneration of the hip, you start getting degeneration of the back, because the back gets jammed together. You don't have that extension, and when you're constantly extended back as far as you can go, it creates a bunch of inflammation in those joints. So this is a major problem, and we'll discuss a little further on the things that you can do for this. So when we have this position, it's important to get the hips back to a neutral position, right? So your posture is a major thing on this. Bringing your shoulders back is going to be important. Like I said, this is difficult to do for a lot of people because they don't have that flexibility through here. So if they bring their shoulders back, they're just jamming all of this stuff back here together, and that causes them a lot of pain, right? And that's obviously not something that is good for them. That's not something that is conducive to them getting better. So what we really need to work on is extending this area, bringing this area back into position. And any stretches for the hip flexors are going to be a good thing for this. And again, I'll give you a little demonstration on one stretch that works really, really well for that. One thing that you can do is tilt your pelvis into a neutral position, and that will allow you that extra room to stand upright. Again, you're bringing that ear to where shoulder and hips are all in line right over the feet. Other thing that you can do is if you lie on a bed and you hang one leg off. So imagine that I am lying down, obviously I'm standing up, but imagine I'm lying on my back and I just hang one leg off of a couch or a bed or anything. It brings that leg back into this position. That can stretch those hip flexors. It's a very gentle stretch. Most people are not going to have problems with that. Some of you may notice that you do have a little bit of tightness there. And without talking to your doctor, and this you want to talk to your doctor before you do any of this. Make sure that this is something that is going to be acceptable for you. You don't want to do something that's going to put you into a negative position, but most people are not going to have problems with this on a short range of motion. If the couch is too far, if you are concerned about it being too far, put a stool down in there and just drop your leg off onto the stool. It can be hanging 6 to 8 to 12 inches off of the couch and still be getting benefit for some people if you're really, really tight. But what we have to do is we have to lengthen these muscles right here, because when these muscles are shortened, you end up bent forward. if your pelvis is bent forward, you're going to experience some of this. This is not the only kind of problem that we can have, though. Let's go ahead and clear some of this junk out. So let's use this same person here, and let's see. There, perfect. So imagine that this is the person standing facing us. So those would be the two legs. Perfect drawing, right? You know exactly what I'm talking about here. So if we have a rotation where one hip is higher than the other, so you end up at an angle like this, again, this leg is going to work as if it's shorter. This leg is going to work as if it is longer. And this is a problem as well, because over time, this puts a ton of extra stress on these muscles, especially on that right side that is going to be affected, the shorter side on this, but it also puts an effect on this. And this is where you can see people kind of waddle as they walk. They don't have stability in their hips. And if you don't have stability, that's a problem, right? What do you get if you don't have stability? You're going to get muscle spasms because you have to have stability. If you don't have stability, you're going to be laying on the ground. That's just the way that it works. And so, again, stretching the musculature that provides that raise in the hip can be very, very important. Now, stereotypically speaking, what do we see in this? More than likely what we're going to see is that this high side has hip flexor tightness again. So that same stretch that we just did where you're laying on the bed and hanging your leg off may be a good fit for you. Again, talk to your doctor before you do anything. We don't want to put you into a position where you're going to get hurt. Likelihood of that happening is very, very low with these types of stretches. They're passive stretches. But again, talk to your doctor. It's very, very important that you do that to make sure that we're not going to move you into a negative pathway. But if we can get this stretched out, then what we end up with is a level pelvis. If we have a level pelvis, we balance out that leg length. And if we balance out that leg length, then we end up in a more stable position for the long term. We end up with less strain on the muscles. We end up with less strain on the joints. We end up with less degeneration. And that's the big part of this, is anytime you're not moving correctly, you're increasing the amount of degeneration that you have. So ultimately, that's what I want you to take out of this. Now, what are other things that you can do? Is massage something that you can do? Absolutely. Massage should be a good fit for this. Is chiropractic something you can do? Chiropractic should be an awesome fit for this, because anytime that you have that muscular tightness, you're going to have the joints affected. If we don't have the joints moving correctly and we have muscular tightness, that's going to cause problems. If we have muscular tightness and we have the joints moving, it's still going to give you problems sooner or later, because that muscular tightness is going to lead to those joints not functioning correctly. So making sure that we have both of those as functional as possible is going to be a good thing. Now, what is the best way to go about this? The earlier you hit this, the better, but if we can target working on the brain, it's something that's very, very powerful in this. Why? The brain is what determines what your muscle tone is, right? So like I said, a lot of people end up having all of their issues on one side versus the other. And this comes from a brain imbalance, a little bit more function on one side than the other. It doesn't mean that there's any kind of brain damage or anything like that. It's just one side is dominant over the other. That leads to muscle tightness in certain areas. For example, those with right brain dominance are stereotypically going to see their tightness here and here, and on lower back it's going to be the exact opposite. Front of the left side, back of the right side. Well, left brain is going to be the exact opposite of that. So if we can focus on training the brain, not only is this going to help that muscle tone, not only is this going to help you move in a more fluent way, help you move in a way that's not going to lead to degeneration, it's also going to help lead you into a position where you have less inflammation. It's going to help you move into a position where you're more resilient to stress. And when you have those things, it's going to make it so your life's ultimately you're going to get healthier. In general, you're going to get healthier because your body's going to better handle stress, and it's going to have more of those resources needed to maintain the things, right? Because as soon as you're trying to work to balance all of this out, all that inflammation and all of that stuff, when you have to work really hard to do that, you don't have all the energy left over to do the other things. So this is going to give you some of those skills and some of those tools that you need to take that next step forward. If you have any questions on this, please reach out. Drop a comment below. If you find this helpful, please like or subscribe. It gives me good information as far as what y'all are needing. Like, what can I provide you to give you the more bang for your buck? So it gives me information on that. So like or subscribe. And as always, I love and appreciate you guys. I know your attention is one of your most valuable resources, and I appreciate you spending a little bit of that with me. So with that, have a great week, and I'll catch you on next week's video.